Essex. And I'm joined by Trudy. Trudy, do you just want to introduce yourself?
Yeah, certainly. Good morning, afternoon, everybody. My name is Trudy Mount. I'm the Programme Director responsible for the shared care record across Herts and West Essex, so working with Vicky on the programme.
Lovely, thank you. So as Heather said, we just have some slides to share with you, so I'm going to take you through a short presentation. We've also got a couple of videos of clinicians talking about how they've used the shared care record and how that's helped them in their roles. So I'm hoping that technology is going to be kind to us today and that you'll all be able to see those. And then at the end, we'll have plenty of time for any questions that people have. So as Heather said, please feel free to pop them in the chat or wait till the end and put your hand up, and I'm sure we'll have plenty of time for that. Okay, so I'm just going to share my screen now and bring up some slides. Okay, lovely. Okay. So, what is the Hertfordshire and West Essex shared care record? So basically it is a big step forward to help solve the problem that is the fact that all of the different providers that you see who deliver care across our area and beyond our area all may hold their records separately. So they all have separate computer systems who hold the information separately, and apart from a few pockets, they didn't talk to each other. And I'm sure that every single person in this room will have experienced what this means from a patient perspective. I know that I have, I know that everyone in my family has, I know that it's something that people deal with day in, day out. From a patient perspective, it means that you are constantly repeating your information, that you can't be guaranteed that the people caring for you can see the information that they need immediately. And obviously from a health and care professional's perspective, it makes working together, being joined up, delivering effective care really, really difficult. So this is a lovely programme of work to be working on, because we have been able to make a really big difference in this area over the last year. And we now have a new piece of technology that connects to the different record systems held across different health and care providers and pulls information together into one place based on the individual rather than the organisation, so that health and care professionals, whichever service they're working in, can view an up-to-date, joined-up summary of information safely and securely. So it's not the full patient record, it won't be absolutely everything that's held, but it does bring together key information that can be accessed quickly, safely and securely. As it says there, the confidentiality is maintained, so it can only be accessed by people directly involved in delivering your care. It can only be opened through an existing record system, and the person who would open your record in their own record system, so let's say that's your GP, and they may use a system one, or they may use EMIS to open your record and to record information about you. They would have to have the access rights and all the permissions to be able to open your record in that system, to therefore go through and actually open up your shared care record. But it is really easy for them to do that. So once your record is opened, they are able to press one button and this screen will open and pull all of this information together for them to use quickly as they are delivering care to you. We know that this saves huge amounts of time. It makes it easier for care to be joined up, for the transfers of care, that it's preventing repeat investigations because people are able to see what's happened before, which is really helpful. And overall, this is helping to make care safer, faster, and help people make better informed decisions. So just a little bit about what it is and what it isn't. So as I said earlier, the shared care record is for health and care professionals who are providing care to you. It's not a portal for patients. It's not for yourselves to access your own records, although obviously we know that's important as well. This is purely a system for health and care professionals who need access to a joined up picture of information about you. It's only viewed within, as I said, within existing record systems over secure health and care networks. A full audit trail of access is maintained, and individuals can object to share all or parts of their records from each partner who is involved. Information is not transferred, it's not used for research or planning, it's very purely and clearly only for direct care. It's would never be, it's not transferred out of the systems that it's held in. This is really like almost like a window, a viewer, so the information stays within the home systems, but a view of that information is pulled together up to date in real time for health and care professionals to view. And it doesn't replace any traditional methods of communication between services. And it all comes under something called My Care Record, which you may have heard of, which for a number of years, organisations in our area have been working together and have all signed up to a set of agreed standards around information security, and agreed that they will safely and securely share this information to improve care. So we started rolling out the system in October 2021, so just over a year ago, and have been extremely busy. And we are now in a position where if a user is to open the shared care record for an individual, there would be information there for them to see. If you had received care at any of the GP practices within Hertfordshire and West Essex, the 2 community trusts that cover Hertfordshire and West Essex, HUC, who provide the out-of-hours service, the Hospice of St Francis and Peace Hospice Care, Hertfordshire County Council, and the 3 acute trusts in our area, so West Herts, Princess Alexandra and East and North Herts, are all contributing information into the shared care record. East and North Herts, we're working with them at the moment to make sure that they can view information. At the moment, they're contributing information, but their staff aren't viewing the information, so that's a work in progress. And in December, we've also connected information in from Cambridge University hospitals. So it's becoming, it's been gradually rolling out over, I said, over the last year, but it is at a point now where there is some really good and useful information in there, and that is being accessed by a large number of partners. So as well as working to join up information in our own area, we recognise that it's really important that care doesn't just stay within the boundaries of a county or an integrated care system. And so part of this rollout and this work in, I guess, what would be seen as the first phase of our delivery, which has been happening over the last year, has been to look at patient journeys and to help put in connections of information that support care. So it's really common, obviously, for people to live on the boundaries of a county, for example, or of an integrated care system. So, you know, I spoke to a patient, you know, not so long ago whose GP was in West Essex but was receiving care in Mid and South Essex hospitals, and was having problems because the records weren't joined up. So just an example there. Also, you know, we know that people travel for specialist care. So in December last year, we connected to the London Care Record. So our shared care record is able to receive information in. So if you were to travel into London for specialist care, so for example, to the Royal Free Hospital or the Royal Marsden, for example, specialist cancer care, information from their record system would be visible, for example, by your GP. So that's there really to support those journeys and specialist care that we know that is so important. I mentioned a moment ago that we have connected information in from Cambridge University hospitals. We're currently working to connect information from Bedfordshire hospitals. So that would include the Luton and Dunstable Hospital. And actually, hot off the press, literally today, we have connected to the shared care record that covers Suffolk, North East Essex and Mid and South Essex. So that means that example I spoke about earlier, where a GP is in West Essex, but now they will be able to see information from the hospitals in Mid and South Essex, for example. And it also means that we're able to securely share information with some key providers that cover more than one area. So EPUT, so Essex Partnership University NHS Foundation Trust, we provide mental health and community care and Essex County Council. So that's a really big step forward, and that's literally just happened today. So we're really pleased about that. Our next steps in this area include that we're working with East and North Herts Trust to make sure that they can view information. We're working with the 3 outstanding hospices that are in our ICS area. And we're working with the partners to make sure that they're sharing as much information as possible. So it really is a journey that we're going on, and we've got a kind of starting data set, and we're trying to make sure that as much useful and valuable information can be shared as possible. Trudy, I'm just going to pause there and see if there's anything that you would add in.
So I was starting just to answer some of the questions, but I've decided we'll do them at the end, and I'll verbally answer the questions, just in case people are worrying. I'm not ignoring the questions, but I thought it'd be easier to go through them verbally. I think probably just to sort of emphasise what you said there, Vicky, that it's growing, and we connect to new areas as we sort of get the opportunity. The trouble with you patients is you do move, so we know that we need to do cross-border working, but we haven't got all of those catered for yet. But we will grow the programme as and sort of, needs arises and opportunities arise. But I think, as Vicky has said, it is an ongoing piece of work, so it grows every day. And today we joined Suffolk, which sounds a bit odd, but it gives us Essex, so hence the connection through there. So I think that's probably all I want to add, Vicky.
Great, thank you. We can come back to this. I'm sure there will be questions. So how much is it being used? So this is a graph which shows, really, I just wanted to show you the upward trend. Obviously, there's a lot of figures on there. It's quite small, so it's hard to see. But, from over the last year, so this is running from January last year until December, so a year's worth of data. And the usage has gone from just under 10,000 in January up to nearly 40,000 in December. So it's a steadily upward trend. We would like it to be higher, and a lot of my role is really around raising awareness with staff and with frontline staff to make sure that they understand how it works, how to use it, and that they understand the benefits, and to make sure as many people are using it as possible. Since it was launched, it's been viewed more than 250,000 times, and yeah, as I said there, it was nearly 40,000 times in December by just over 3,000 health and care professionals. Lovely. I've just got a couple of videos here just to share with you, and I think they're going to be slightly smoother if I come out of the presentation and show you directly. So just bear with me a moment. And really, I wanted to share these. So I've been, we've been surveying users, and we've been conducting interviews with people using the system to find out, what do they like about it? What would they like to see more of? How is it helping them in their roles? And I've just got a couple of videos that I'd like to share with you. So you just hold on one moment. I will come out of there and go directly into the video, which I think will work slightly smoother. Okay, so this first one, sorry, again. This first one that I'm going to show you is a case study. So somebody who works within A&E at Prince Alexandra. And really, just to caveat these videos, they're not high production values. They were filmed by me using Teams or Zoom, really just to capture the message and to capture the feedback, so that they are slightly jumpy. So I apologise for that, but really it was just about capturing the feedback.
My name is Oliver Holman. I'm one of the FY2 doctors at Princess Alexandra Hospital, currently working in A&E. I use the shared care records for every single one of my patients to check for their medical histories and their drug histories. There was a patient I saw the other day who was having seizures in the department. I think he had complex mental health problems, had never presented to Princess Alex before, but I checked on the the shared record, and all of his records from Croydon Hospital came up. So I was able to read various letters and then find out the diagnosis. We found out what medicines he needed to be prescribed to avoid him having further seizures in the department. When you take drug history from a patient, it's not necessarily reliable. Even things like insulin prescriptions, if you prescribe too much insulin to someone, you could send them into coma or something like that. So certain medications I would only prescribe to someone if I see a written record. It definitely avoided an admission in this case, or potentially having unnecessary treatment, unnecessary scans. We referred him straight to the social services and they dealt with him straight in the community. Most patients, if you can avoid admitting them into the hospital, it's the best thing for them. Work gets repeated so often in the NHS. It's very, because of the nature of how everyone is in their own team, and that historically all the records have been broken up, and it just makes our job a lot easier when all the information is in one source.
Lovely. So that was the first video. I'm just going to share one more quickly. It's a similar length, not too long.
Shared record when I am taking patients' medical history. It's useful if the patient's confused or they're unsure of the tablets they're taking.
It really improves communication across the services. It keeps me informed up to date. So, for example, I might be going to discuss a patient, and then maybe that morning I might have a quick look on the record before the meeting, and I find the patient's been in touch with out of hours or with the GP and has got an infection or has been admitted to hospital. And yet I'm right up to date.
It has definitely made our work more efficient, safer, more effective. It's quicker. You know, you're able to get something on the spot and just bounce an email straight to the GP and say, you know, we need to repeat this bloods before we book this patient in for surgery. Or it could be that the results are great because we've got them, we book the patient in, and it makes the patient's journey and experience better as well.
Patient safety is the number one priority, really, and having a shared care record means that you're not prescribing something that might be harmful to them. You're not doubling up on a vaccination that they've had, for example, a year ago, and they can't remember having it. So patient safety is top of the priority.
The time we are saving, chasing results or requesting investigations of lab tests, we are then able to use to form direct face-to-face or even direct contact. Previously, patients would ask, you know, don't you guys talk to each other, or don't you have access to motherhood already, or didn't my GP have thought about this already? Whereas now we're actually able to say to them, actually, yes, we do talk to each other now, and we do have access to what we need, and this is how we can help you because we've got access to it.
You're just kind of more in control, and it's just there at your fingertips. You don't have to be thinking about who do I contact for this. It's all there on one page. I use it, yeah, very, very frequently. I mean, every day I'm using it on different patients, and I'm going to be using it even more now that it's improving all the time.
Go. So hopefully you can hear the sort of feedback and the themes that are coming back and the things that I mentioned at the beginning. So very clearly we're hearing that it's saving time, that people feel that it's improving patient safety, that it's making it easier to work across services, that it's making it easier to make effective decisions. And the more and more information we get within this tool, that is really helping people, the better. So that's really the end of the formal beginning bit of the presentation. I hope that's helpful. And now we'd love to start answering some of your questions. Trudy, you've been looking at the list. Do you want to start?
Yeah, if I'll pick some of the ones off the list, and I'm sure as we go through, a lot of them will be covered anyway. Very first question was, will Harpenden Red House be accessible? Do you mean Harpenden Memorial Hospital?
Yes, yes, I do mean Harpenden Memorial Hospital.
Okay.
It's the only hospital we have in Harpenden.
Indeed. So Central London Community Health, who run the services, I believe, out of Harpenden Memorial, so that the community trust that are based there, they are involved in this. So you can, the other professionals can see their records and they can see other professional records. So yes, but from that perspective, they are, if that's the organisation. Yes, it does use the NHS number in the main. Always check other bits and pieces as well, but it's usually the NHS number that we use to link people. Patient access to own records. That's a separate piece of programme, and there is work ongoing on that nationally. So there will probably be similar meetings to this one around that at some point later this year, but that is something that is being looked at. Isabel Hospice, I think Vicky covered that one. Isabel Hospice we will hopefully join up to in the next couple of months. So they should be there. London hospitals, yes, London hospitals are covered. So Royal Free, which is the big one, most of those are covered. So for the Hertsmere practices particularly, and the Watford, etc., that should be good. Opting out, Vicky, do you want to cover opt out?
Yeah, sure. So I guess the first thing to say is that this kind of information sharing is covered under the UK GDPR. So under data protection regulations, there's very clear legal basis for sharing information for the purposes of direct care to support the delivery of care and social care. So that's the legal basis that we're using to share this information, and is absolutely, as I said, confidential to the people delivering care to you. And as you've seen, really important for the safe and effective delivery of that care. And this is information that would have been shared and is shared through traditional methods. So it would have previously been shared and still is shared through letters between services, through phone calls, through you conveying this information as you go to meetings. It's just a more effective way of doing that. And it's also just to kind of separate it out from other kind of data opt-outs that you may have heard of that are more to do with your kind of patient identifiable data being used for research and planning. So there's a separate national data opt-out for that. If you felt strongly that you didn't want your information to be securely shared just with the team of professionals that are caring with you for a reason, you would need to speak to those individuals at each organisation, and they will consider withholding your record from the shared care record. So it absolutely can be done, but it's something that you would want to do in conversation with a professional to understand what would that mean for my care, and what would that mean for safe delivery of care, and really understand that conversation. But if you do want to object to that information being shared, you can do that. It may be that you might want to consider whether there's just something that's particularly sensitive that you don't want to be shared, and maybe ask for one specific piece of information so that you don't lose out on all the other benefits. But if you still feel strongly that you don't want your record to be available in this way, you can do that, but you'd need to speak to each of the organisations that holds your record and ask them to do that for you. Any other questions on that?
Timescales for Bedfordshire, Milton Keynes. Easter-ish is the plan. So sort of, certainly within the first half of this year would be our plan for that one. But obviously you can never tell with technology. Sometimes it doesn't work the way we think, but that is certainly our plan to be doing it sooner rather than later. So it's pretty much the next one on the list, Vicky, I think, isn't it? Bedfordshire, yeah.
It's underway. The project is technically underway.
And Deborah, you've put several questions, so do you want to ask a question and then I'll hopefully be able to answer it in the round?
That's me, is it? Yeah.
Yeah.
Okay. Well, as you've seen from the side chat, I do a lot of these meetings with the NHS for mental health and things. So, I'm at the forefront of knowing what's going on. When this was decided quite a few years ago, it ticks every box and it makes so much sense. If you're in another part of the country and you've become unconscious, then yes, if someone can log into your records, and as the doctors on the slide said, helps with medication, helps with your back records. I signed up for it. Last week, I was at a hospital and I'm in a catchment area between Whipps Cross, which is part of the Barts Trust, and the Princess Alexandra in Harlow, and I've got a major heart problem going on. And Whipps Cross had no idea of even when I had a blood test. So, you know, if this is going to be implemented, it's got to be done soon. I went to Whipps Cross thinking that they knew everything about me, down to the blood tests that I'd had, and they've got no details on me at all. So what did I sign up for 4 years ago? It's left me pretty frustrated.
Okay. So I don't know exactly what you signed up to 4 years ago.
Shared
Because the-
access, apparently.
Yeah, the shared care record is an opt-out model. So you don't opt in. We share your information unless you tell us not to. But
Well,
I'm not that
then.
familiar with what's gone on in sort of that far part of Essex. It's not an area because we're West Essex.
Yes,
There may have been some other bits of information. And Whipps Cross isn't one of our hospitals. So whilst we can see some of their information, I don't know what they can see about us. So we'd have to try and find that out. Vicky, do we have contacts over that way that we can just have a little bit of a...
Do they come under, I'm sorry that I don't know the answer to this. Do you say that they come under Barts?
Yeah.
Well, Whipps Cross is part of the Barts Trust, Princess
Yeah.
Alexandra. But I mean, is this going to be rolled out nationwide, or is it just going to be particular areas?
So it is
defeats the
being more, yeah.
purpose.
No, I completely understand where you're coming from, and I think it's just part of an evolving picture, and I'm sorry it hasn't quite caught up to help you on that occasion. But I know that Barts are using the system, and if you think of it like a spider web, so we've got something called a health information exchange, which is the technology that makes this shared care record, and we're connected to all these partners in a hub, and all of our sort of local partners, including Princess Alexandra here, and then in London they're also connecting, so they're working, and across the country people are working to create these networks, and then we're looking for opportunities to how do we join these hubs together. Because really it should be, as you say, wherever you are in the country, it would make sense that if something happens to you, you know, people would have the information they need. And to a limited degree they do, because we have the summary care record, which is information from your GP record. So they do have some information. But in terms of this shared care record and getting more rich information from lots of different providers, we have connected to the London care record. So I would say that Barts should have been able to see, somebody in Barts with this access, which they should have been able to see information from the Princess Alexandra Hospital. Princess Alexandra Hospital are not sharing pathology results yet. So it may be that they couldn't see your blood test result, and it may be that they, as I say, we're working constantly to make sure that health and care professionals know about this, that they understand the benefits and that they're using it. But we're really not at a point where everybody is, and it's an ongoing battle and kind of journey to get to that point where this is standard practice and everyone is doing it constantly. So I think it's probably a combination. It's probably a combination of PAH not sharing pathology results yet, maybe the person in Barts not being aware that Princess Alexandra is available to them and thinking they've only got London information. And I obviously I don't know completely, but I think we are getting there and it is evolving and moving forward. But I'm sorry it didn't meet that problem you had this week.
And just following on from that, just as you were speaking then, Vicky, you may have signed up for something called the summary care record with additional information, which was an opt-in. And that was your summary care record plus a lot more of your GP information. So that was your demographics, medication, sensitivities and allergies, plus sort of about 90% of your GP record, and you had to sign up for that or opt-in. All NHS professionals, providing their smart cards and that have been enabled appropriately, should be able to access that. So, and there was a question around if you're somewhere else in the country. If you're in one of those areas Vicky talked about, you can potentially access our shared care record. If not, you should be able to access the summary care record, which does have that, as I say, it's about 90% of your GP record. It would certainly have your current medications, etc., sensitivities, allergies, and key diagnoses. So that would be a help. If we always use, you know, if you fall over in Cornwall, break your leg, it would definitely, they should be able to see that, which would get them a long way to being able to treat you, even if they haven't got the more sort of detailed information about you. Okay. Do you know who was next? I think it was Andrea.
I think
It's Andrea.
Oh,
It's
I'm just going to
Andrea.
pop in really quickly. I was going to put, there's a comment from Martin Norman saying that is there a role for patient groups to liaise with GP practice to promote awareness? Yes, please. Link to this, you know, I think that's the biggest ask really. Please, yes, please. Yeah,
and that's something we can explore with our patient groups, with who we're in contact with anyway. Yeah, lots of questions flooding in, which is brilliant. So Andrea was next. I'm just looking at the list. So Andrea's next in.
Yeah, hi. My question was the one about the opting out, and I think I might have put the wrong emphasis on some of my question, because I'm not I don't have any concerns about the actual system. It's something that I work towards in my professional life for a lot of years, and I know all of the benefits that are available to it. My concerns are at the patient end, where the information is not necessarily communicated to patients as much as it needs to be in advance, and a lot of the interaction then is left with a receptionist who doesn't understand necessarily all the answers to, or doesn't have all the answers to the questions. And you said something that I find quite concerning, which is that you'd have to speak to somebody at each of the services if you wanted to opt out. Who would you speak to? How would you know to do that? And I think that sort of like disregards the fact in a way that we have a large number of people whose first language is not English, but also we have a large number of people that don't have access to, that they are excluded from the digital age for whatever reason. And a lot of the thing that you need to be aware about, because I run a community group now, is that a lot of people run on pay as you go, and when they try to access, data to interact, so to opt out, for example, or to find out about this information, it's eating up their data. So I'd like to be reassured really that you roll out programs to make patients aware that this is going on, and how they opt out if they choose to, that it definitely has to be in different languages. You definitely need to communicate all of this information to community groups so that they can make their membership aware, and also the process for opting out. I just cannot see, having worked in a acute hospital for 25 years, managing frontline staff, how a patient is going to opt out when they come in. If they're asked, do you want to opt in or opt out, and they say no, what is the receptionist going to do?
Okay, there's an awful lot there and some really, really good points. Thank you, Andrea. So firstly, they won't be asked if they want to opt in or opt out. It is assumed consent based on GDPR, because the benefits of this are so massive for people that it's really important, as much as possible, this information is shared. And then in terms of getting that message across, so we're trying to, I agree, I think there's a lot more that needs to be done, so I would agree with you. And then I think that also we are trying to do that from a number of angles. So we have non-digital materials such as posters that point to our My Care Record approach, which again does link to a website. So I take your feedback completely that is then digital, but that people can speak to then somebody within that organisation. In the training that we do for the shared care record, one of the key points that we put across is that whilst you don't need consent, you do need to be transparent. And if you have the opportunity to say to somebody, I'm going to look at your community record now, or I'm going to look at your GP record, and it's not saying, can I? It's not asking for consent. It's just saying, I can find that information because I'm able to see this record. And that, I think, is the best way of actually getting round those hurdles, because however many posters, however many articles, however many written bits of communication you do, you're not going to find it. So as much as possible, I'm trying to support a culture of transparency, where people are telling individuals that they can do this. And then the message really that we're having with clinicians and health and care professionals is that you know, that it's really important for people's safety, that as much as possible they understand that this is safe and secure, and that the benefit for them is to stay opted into this and not to object. But if they do want to object, then that would need to go through a process with their organisation's data protection officer, and that person would have to do that and manage that and take it through to that person. We have had so few, I don't think any organisation has come back to me and said that their data protection officer has had somebody come back and actually asked to be opted out of this. It's really, really little, but that transparency is really important, and I take on board all of those points that you made, because I think you're right. You're absolutely right on all of those. Thank you.
Yeah, thank you. Angela is next, I think.
Thank you. Does the Central London Community Healthcare Trust still exist? Because I didn't see it on your list. Thank you, it does.
Yeah, it does. It should have been on there. So yeah, it is, and they do use it and they do contribute.
Thank you.
So they're very much involved. Thank you.
Lovely, thank you. Kumar. Hello, Kumar. You're next.
Thank you. I have two quick questions. Vicky, in answer to an earlier question, mentioned a spider web and connection to that. I think the phrase she used was health information network or something along those lines. Now, that's the first question. Who owns that network, the main node? Is that externally outsourced entity, or is that an NHS entity? Is there public information available, or is that secreted secret information that will fail one day in the near future, and then we'll write off another 10 billion as a foolhardy exercise? That's one question. The second question, I do thoroughly support the ambition. Data integration is something that I would have supported 20 years ago, and I still support it. However, for it to work, it needs participation. So the question, what is the commitment and what are the processes that's already been put in place to ensure that the commissioners of the services, both in terms of retrospectively gaining commitment from all health and social care clinicians and participants to use the system, and going forward, right into all contracts, the absolute commitment and penalty if they don't use the system? Thank you.
Brilliant questions. Thank you, Kumar. The technology I mentioned, then I'll hand over to Trudy. The technology I mentioned is called the Health Information Exchange, and it's provided by a company called Cerner. So they're not an NHS provider, they're a private provider of technology. But the technology is hosted at West Herts Hospital. So the technology is actually hosted by the hospital. And it's, I guess the other thing to point out about it, it relays information into a view, but it's not like a central database that's holding this information. It pulls it in real time as someone requests that information. It's not taking it away and storing it. It's literally like a window into these other systems. But Trudy is more technical than me, so I'm going to hand it back to her for the next bit.
Yeah, I wasn't going to add very much to that, Vicky, actually. So yeah, it's the Cerner HIE hosted at West Herts Hospitals. It's used by quite a lot of other NHS organisations. It's a bit of an odd. It's a piece of software rather than a physical network per se. It's not so it uses the HSCN connections, etc. It's not sort of a physical network. It's a software solution with some sort of programming and etc. behind it. So it is sort of inbuilt into everything that we've got, and we're not the only user. There are a lot of them around the country. So hopefully that gives you some reassurance about that part of it. The other part, I suppose, so all of the key providers we have in our area at the moment, and by that I mean the bigger providers, not some of the small little community providers, but the bigger providers are all signed up and I think are pretty much all contributing and are part of the shared care record. NHS contracting, I can't really go there. I mean, there are bits and pieces in the contract around digital, and that gets more involved all the time. So we work as part of the contracts where we can. We have all of the partners at the Shared Care Record Board to ensure that they're all committed. So and in the last, I think as Vicky said, in the last sort of 18 months, we've managed to get most of them connected and moving forward. If there are new contracts with new providers, we will always aspire to get them connected and get them part of the programme. That can depend on the system they're using, because there's work involved in getting the systems to talk to each other. So if they turn up with a system we're not familiar with, then that's going to be harder work for us than if they're using one that we already know and have connected. So I think but moving forward, I think there is a much bigger drive to make those things part and parcel of everything that we do. But we certainly have commitment from all our existing partners, I think.
Okay, so come back on that. So would it be fair to say that although it's a great ambition, it's not much more than finger up in the air and a great hope that it will build up enough traction in the big wide world before it runs out of money?
No, I don't think that's fair.
Well, I think it is.
We've already got it. We've got it, and it's working, and it's being used. Yes. So it isn't an aspiration; it's a reality, I would say.
Yes, but they didn't actually gain much traction. Anyway, I hope it will work. Now, the most important thing is, can I also advise, can I also counsel, when you come up with new propositions like this, please be open and transparent to public and patients like us. Tell us the whole story. Don't come out and actually tell us, here we have a new model, a new system, which we are rolling out, which is going to solve all the problems. Tell us the problems built into it. Like, for example, if Cerna goes belly up tomorrow, what will be the problems? If Cerna can't actually keep up with the demand, if we are successful, and many, many trusts take this up, what will be the issues? If the government decides that it actually has a better or a much favored IT provider to favor as opposed to Cerna tomorrow, then what will happen?
Kumar, I'm going to hurry you up here because we've got quite a few questions. Sorry, I don't want to interrupt and be rude, but if you can just sum up for us.
Okay, and summing up, same thing about commissioning. Unless everybody is committed to it, and that has to be built into contracts, not wish that their systems will work with your proposition. Thank you.
Thank you, Kumar. Thanks, you,
Kumar.
So, Ian, thank you for your patience as well.
Thanks. Hello. I live in Hemel Hempstead, so I guess I'm under the West Herts Hospitals Trust.
Yeah.
Local GP service, right? I was in Hitchin in a restaurant on Saturday when I had a suspected cardiac arrest. Thankfully, it wasn't, but luckily there were two doctors in the restaurant, mother and daughter. One a hospital doctor, one a retired GP. They couldn't detect the pulse, couldn't detect that I was breathing, so thought I was in cardiac arrest, gave me CPR. Luckily, another stroke of luck, two ambulances round the corner in between shifts. East of England, luckily not on strike, so they were at hand. Taken to the ambulance, and ECGs, all the vitals were done, BP, blood test, you name it, blood sugar test rather. They asked me my meds, what meds I was on. I managed to rattle out a few, but I was a bit disorientated, as you can imagine. And I managed to look at my watch, patient access, got them from there. But I was surprised they couldn't access it. directly from their computer, their laptop. And then they asked me about my UNEs because it was linked to sodium and other stuff. And I said, yes, I'd had issues recently, but again, I couldn't recall the precise numbers, and I haven't got those on my phone. They're not on my medical records, which is a big issue. And then when I got to Lister, that was 10 minutes down the road, which I have to say was great. I mean, I got straight into a cubicle and they did all the vitals again, bloods, ECG, X-ray, you name it. But I was there for about 5 hours. And when the doctor came to see me at the end, he explained it wasn't a cardiac arrest. It was something called, if you're interested, never heard of it before, vasovagal syncope, which is where your blood vessels, I think, expand, and it means the heart rate drops very quickly and blood pressure drops very quickly, and hence blackouts, blah, blah, blah. But it wasn't likely to be a cardiac arrest. But then he asked me about my medical records, and I'm surprised, okay, he's in Eastern North Herts, so there isn't a full linkage there, and I didn't have all this information to hand. I will do in future. I'll make sure I download it on my phone, but it really does concern me. We're in the same county, and he didn't have this access. And the final thing I'd like to say, he gave me the discharge notes with UNEs and everything else to take to my GP. Why couldn't they have emailed it over, or are they still using fax machines? Then, first thing Monday morning, it might have been picked up. So I had to go today to take it there in person. I couldn't go yesterday. I'm having oncology treatment at Mount Vernon. And I said, look, I obviously need some telephone callback quite soon. And the earliest they can do it is the 3rd of February, which is nearly 3 weeks away. So, it's not a very good, satisfactory result for me. Apart from the fact I'm alive and here to tell the tale.
Indeed, and very pleased to see you. I suppose Lister Hospital aren't using the shared care record at the moment to look at information. They do have other options. Again, going back to the summary care record, potentially they could use that. I can't comment on why the individual doctor may or may not have. So that's something we can feed back, that just to make sure that they've got that. But as I think Vicky said, hopefully we will be joining them up soon so that they can view the information.
When do you think that will be?
I honestly don't know. Depends on a few other things, but what we'll try and do is keep Heather updated as things come online, and then you can hear about that.
In the meantime, is it advisable to inform patients? They should really keep their own records. I mean, it's been drummed into me, having been diabetic for 22 years. Know your numbers, HbA1c, etc. And I do keep records, and I keep more detailed records than I think that exist at my GP surgery.
I think that's probably a personal thing for you, and depends on your situation. I couldn't advise you one way or the other. I'm an IT program manager. Probably not my area of expertise.
Okay.
I think it's a really good point. I think it's really why this work is so important. I think it's a brilliant example of exactly why this work needs to continue, and why it's just an absolutely brilliant example. I'm so pleased that it has, in essence worked out for you, but that it wasn't as easy as it should have been. And you shouldn't have to take your own notes with you. And like the A&E doctor there on the video was saying, unless he sees it written down by a clinician, he can't always trust that information, and he wouldn't feel safe enough to do it. So I don't think advising patients to keep their own records, whilst in some instances I think it probably is really helpful. I know my grandmother, for example, has it all written out, and every time she has to go to hospital from the care home, my mum's like, have you got your list? Have you got it? Because it's so important. But it shouldn't be the situation, and that's why this work is so important. But we are still, we've got a lot connected, but we're still working. Even the ones we've got connected, they need to be sharing more data, and we need to get more and more people using it. So it's a journey.
Okay, thanks.
Thank you, and thanks, Ian, for sharing your experience, and I'm really pleased that you are able to be here today. So we've got one more question. Trudy, are you all right checking just through the questions in the chat so we can round up? We only have an hour, but as we said before, there are other opportunities that we will be able to get back to. So George, I know you joined us a bit late, but
Yeah,
I know you had some
apologies.
specific questions. No problem. Thank you.
Yeah, and I don't know whether that was already discussed, but our particular interest in Tring and area is that we use Bucks Healthcare Trust rather than West Herts because it's much closer to us. So what is the situation regarding Bucks Healthcare Trust and the shared care record? Are they only able to access the summary, or can they access that shared care record?
They can currently only access the summary care record. We haven't engaged with Bucks yet, but as we sort of, finish off the things we're doing, we'll start looking to see where we might need to be looking in the future. And I'm sure Bucks will form part of that conversation because of that border we have over there. Yeah. And the supplementary to that was on the current list, it suggested that Herts GPs weren't also on the shared care record yet. Yeah. No, all Herts GPs are on the shared care record. Oh, they are. Right. Yes. So that information is inaccurate then.
It should be on the list. It should be on the list. Where are you looking at, the website or the slides, George?
The website.
Oh, let me check that. I'll double check that today because I keep that up to date.
Last time I looked, it said that it was listed, but it was greyed out, which suggested it wasn't currently live.
Let me have a look at that. That may just be an error. No, they absolutely are live.
Just a final one on that is the advanced decisions that a patient may have made via their GP. Is that part of that shared care record?
Yes, it would be. So I think I did see your email, George. Thank you for sending that through in advance. Yeah. And I know that you asked about whether it's the full record. So it's coded. It's the coded information. So if there is an advanced decision that's in place that a GP has recorded as a code, which they should do, it would be shared. And also just linking that then to another question I've seen in the chat about kind of sensitive information. It isn't the full record, and there are some codes that are automatically excluded, such as things like terminations of pregnancy. So things that are known to be very sensitive aren't always automatically included. It's not a big list, but there are some things that automatically don't come across.
Lovely, thank you. So Trudy, anything from the chat that you've picked up that you may be able to respond to in our last few minutes?
Don't think there's anything on there that we haven't covered. If anyone thinks there is something I haven't covered, we've missed. I don't think there is. Oh, somebody's put their hand up.
Okay, last question then, Jackie, over to you.
Sorry, bear with me. It's Alan here for Jackie. I just
sorry, Alan.
Right, out of interest, the searching. There's been a lot of discussion about people going places and the user at that point not being able to find them. Do we, as a patient, have to tell the user what hospital we've been to recently so that they look there, or do they just say, "Look for Alan and you'll find him"?
Yeah, what happens is they would put in probably your NHS number. It does use some other demographics just to double check the link. And then it will pull information from all of our connected sources and display them. So if you've been, you don't have to say, look for my, it will display the information that we have from all of our connections on you in one place. So it doesn't require the location.
That's brilliant. Thank you.
Lovely, thank you, and thank you everyone. So we're coming to the end of the meeting. We've got a couple more minutes. Vicky and Trudy, is there anything you want to say to sum up, or just mention anything you may have forgotten?
I was just
Joan's question about clinical trials. I suspect not, unless it's in your GP record and coded, it probably wouldn't be shared. But I don't know where that sort of information is generally, to be frank. I don't know where that is, but
from experience, it's all over the place.
Yeah, my gut feeling is no, unless it's coded somewhere in your GP record, it probably isn't.
That's why I carry it in my handbag. Thank you.
I was just going to mention on the invite that Heather sent out, there was a link to the website, and I will double check the list, but I do try and keep that super up to date. So as soon as we get a new partner, I put them on there. And I also, as soon as we've got a kind of confirmed, as confirmed as anything ever is in the project world, date of a new partner joining, I also put that on there. So if you want to kind of keep up to date with what's coming next, please look on that page that Heather has sent out, and you should be able to kind of have as much confirmed information as we have.
Lovely, thank you, and thank you, Vicky and Trudy, for coming and speak to the group. Jeff, is a quick one because we're just finishing up.
Yeah, just very quickly. How safe is it that when you're sharing the record, you've got the right person to share?
So with any records in a hospital, normally they'll go, can you confirm your name and address kind of thing. I expect they do. Vicky, in the training, do they cover sort of how they do that? I mean, I suppose they will have gone from the system they were in, so they will check your NHS number, name and address, and confirm that right person, and then that links and pulls all the information together using the NHS number. But clinicians should always be doing checks all the time as part of general record keeping, whether it's electronic or paper records, to ensure that they're looking at the right information. So that's sort of in their general mindset and training and practice, not unique to this. We're very clear that clinicians should always be checking whether they're looking at bits of paper, letters, or whether they're looking at it on a screen. They should always be doing the due diligence, and they do that. So
yeah, okay, thank you.
Thanks, Jeff. Okay, thank you all very much for your time. Thank you, Vicky and Trudy, for presenting that to us.
Good to see some familiar faces on the screen as well.
Lots of questions, which is always a joy. So what the next steps? I will send out the recording. Somebody asked in the chat. Yes, the recording will be made available. We'll send that out. Please share it with anybody who may be interested. Any questions, then just email them through to me. I can ask. Any feedback, if you experience, go somewhere and experience this, positively or negatively, then let us know. Will be interesting to find out, and then perhaps we'll come together when we've got something else to tell you. But in the meantime, thank you very much for your time, everyone, and we look forward to seeing you at other meetings.
Thank you, everyone.
Thank you, everyone.
Bye.
Bye.